Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our inhaler series for asthma. Asthma is one of the most common allergic diseases affecting both children and adults, and inhalers remain the cornerstone of treatment. They are well established, extensively studied, and proven to be safe and effective. While I have previously covered nearly all FDA-approved biologic therapies for asthma, this series shifts our focus back to inhalers, introducing them one by one. In this episode, we'll focus on an inhaled medication that redefines how we think about rescue treatment. In 2019, the Global Initiative for Asthma, also known as GINA, released updated recommendations that many experts consider the most fundamental change in asthma management in the past 40 years. GINA no longer recommends treating patients with asthma using short-acting bronchodilators alone. Instead, they recommend incorporating corticosteroid-containing inhalers used either symptom-driven in mild asthma or as part of daily therapy to reduce the risk of severe exacerbations. The reason behind this is actually quite straightforward. When asthma symptoms occur, bronchodilators can open the airways, but they do not treat the underlying airway inflammation that drives the disease. Using bronchodilators alone leaves that inflammation unchecked and has been linked to worse outcomes, including a higher risk of severe exacerbations and asthma-related mortality. What patients truly need is an approach that both opens the airways and suppresses inflammation, allowing for better disease control. And that is exactly where Airsupra fits in. Airsupra combines a short-acting bronchodilator with a corticosteroid, delivering rapid symptom relief while simultaneously addressing airway inflammation. In this video, I will walk you through 5 key things you need to know about Airsupra: what it is, how it works, how to take it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Airsupra and who is for? Airsupra is an inhaled medication approved by the FDA in January 2023 for the as-needed treatment or prevention of bronchoconstriction and to reduce the risk of asthma exacerbations in adults 18 years of age and older. It is important to emphasize that Airsupra is not a daily maintenance inhaler. Patients who are already on long-term controller therapy, such as a daily inhaled corticosteroid or combination inhaler, should continue those medications as prescribed. Airsupra is used as needed, either when symptoms occur or before anticipated triggers. Second, how does Airsupra work? Airsupra works through 2 complementary mechanisms. Albuterol is a short-acting beta-2 agonist that relaxes airway smooth muscle, leading to rapid bronchodilation and quick relief of symptoms such as wheezing, chest tightness, and short of breath. Budesonide, on the other hand, is a corticosteroid that targets the inflammatory process in asthma. Corticosteroids reduce inflammation by suppressing multiple immune cells and inflammatory mediators involved in both allergic and non-allergic asthma. By delivering budesonide at the time symptoms occur, Airsupra addresses inflammation early rather than allowing it to persist or worsen. By combining these 2 medications in a single inhaler, Airsupra treats both the immediate airway narrowing and the underlying inflammation driving asthma symptoms. Third, let's talk about dosing and how to take Airsupra. Airsupra is taken by oral inhalation as needed for the treatment or prevention of asthma symptoms. Each dose consists of 2 inhalations. Each inhalation delivers 90 micrograms of albuterol and 80 micrograms of budesonide, for a total per dose amount of 180 micrograms of albuterol and 160 micrograms of budesonide. Patients should not exceed 6 doses or 12 inhalations within a 24-hour period. Using more than the recommended amount can overstimulate the heart and nervous system, leading to serious cardiovascular effects and, in rare cases, life-threatening complications. Proper inhaler use is essential. Correct priming and inhalation technique are key to achieving full benefit. Detailed instructions are available in the Instructions for Use section of the package insert and on the official Airsupra website. Because Airsupra already contains albuterol, additional beta agonist inhalers should be used cautiously to avoid overdose. Certain medications may also interact with Airsupra. Beta blockers, for example, may reduce the effectiveness of albuterol and even trigger bronchospasm in patients with asthma. If a beta blocker is necessary, such as after a heart attack, a cardioselective agent should be chosen and used with caution. Some diuretics or water pills may worsen low potassium levels when combined with Airsupra, especially at higher doses. In some cases, monitoring potassium levels may be considered. Extreme caution is advised when Airsupra is used with MAO inhibitors or tricyclic antidepressants or within 2 weeks of discontinuation of these antidepressants. In patients taking digoxin, careful monitoring of blood digoxin levels should be considered while on Airsupra. Furthermore, strong CYP3A4 inhibitors, such as certain antifungal medications or HIV treatments, may increase systemic exposure to budesonide. Reviewing all medications, over-the-counter products, and supplements with a healthcare provider or pharmacist is always recommended. Fourth, let's review important warnings and precautions. Hypersensitivity reactions, including anaphylaxis, have been reported with albuterol and budesonide, the components of Airsupra. If symptoms such as trouble breathing or swallowing, chest pain, severe itching, skin rash or redness, or swelling of the face, mouth, and tongue occur, stop the medication immediately and seek emergency medical care. If asthma symptoms continue or worsen after using Airsupra, or if the inhaler is needed more often than usual, this may indicate uncontrolled asthma and requires prompt medical evaluation. Sudden worsening of breathing, coughing, and wheezing, known as paradoxical bronchospasm, can occur with inhaled medications, particularly with first use of a new canister. If this happens, stop using Airsupra and get medical attention right away. Airsupra, like other beta agonists, may cause cardiovascular effects such as increased heart rate or blood pressure and may require drug discontinuation if this occurs. Beta agonists have also been associated with ECG changes, although the clinical significance is unclear. Airsupra should be used with caution in patients with cardiovascular diseases, especially coronary disease, heart rhythm problems, or hypertension. Airsupra should be used with caution in people with seizure disorders, hyperthyroid disease, or diabetes, and in those who are sensitive to stimulant-type medications. Medicines like albuterol can also temporarily lower potassium levels, which may affect heart rhythm. So potassium levels may be monitored during treatment. Because Airsupra contains a corticosteroid, it may affect the immune system and increase the risk of infection. Contact your healthcare provider if you develop signs of infection, such as fever, chills, worsening fatigue, new pain, nausea, or vomiting. Patients should avoid exposure to contagious illnesses like chickenpox or measles and discuss any past infection or exposure with their doctor. Inhaled corticosteroids should be used with caution in people with current or past tuberculosis, untreated systemic fungal, bacterial, viral, or parasitic infections, or herpes infection of the eye. In addition, inhaled corticosteroids can cause a fungal infection in the mouth or throat, called thrush. Rinse your mouth with water and spit it out after using Airsupra to reduce this risk. If thrush develops, treatment may include antifungal therapy and temporarily stopping Airsupra. Using Airsupra at high doses or together with other steroid medicines for asthma, allergies, or skin conditions may increase the risk of systemic steroid effects, including hypercorticism and adrenal suppression. Patients should be checked for other steroid use and monitored for these effects, and treated if they occur. Long-term use of inhaled corticosteroid like budesonide in Airsupra may contribute to the development or worsening of glaucoma and cataracts. Patients with a history of eye problems, including glaucoma and cataracts, should have regular eye exams while using Airsupra. Any new vision changes should be evaluated promptly. Lastly, long-term use of inhaled corticosteroids may also lead to bone weakness. While the impact of small changes is unclear, people at higher risk, such as older adults, postmenopausal women, smokers, those with poor nutrition, limited mobility, a family history of osteoporosis, or long-term use of medications that cause bone thinning should be monitored for bone loss and treated if needed. And finally, let's review side effects and safety. In asthma clinical trials, the most commonly reported side effects with Airsupra included headache, cough, hoarseness, and localized fungal infections. Overall, the safety profile was consistent with what we already know about inhaled albuterol and budesonide. Post-marketing experience with the individual components has identified additional adverse events. While it is difficult to determine how often these occur or whether they are directly caused by the medication, these reports reinforce the importance of stopping the inhaler and consulting a healthcare provider if new or worsening symptoms develop. And there you have it, 5 key things you need to know about Airsupra, the first FDA-approved dual-action rescue inhaler designed to both relieve asthma symptoms and reduce the risk of asthma attacks. By combining rapid bronchodilation with anti-inflammatory treatment in a single inhaler, Airsupra represents an important evolution in modern asthma care. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.